the 5th of July 2023, the NHS celebrates its 75th birthday. Since it was founded in 1948, the NHS has evolved and developed into one of the largest and most respected healthcare systems in the world. It provides a wide range of services to millions of people at free, the point of use, for everyone. This 75th anniversary is a significant milestone, an opportunity for all of us to appreciate and reflect on its importance in providing healthcare services to everyone. However, it's also important to acknowledge the challenges that the NHS currently faces and how the NHS will inevitably shift and develop over time to meet these challenges as effectively as possible. The NHS today is, of course, very different from its early days of 75 years ago, just as our society is also very different from how it was 3 or 4 generations ago. The NHS of tomorrow will continue to adapt to meet the emergent new challenges, as well as the ones we're currently facing. These include increasing demand for services, high levels of chronic long-term ill health, workforce shortages, and the need to make the best use of new technologies and treatments. Hello, and welcome to We Work Together, our podcast about working in partnership to improve health and care for everyone in West Yorkshire. As you might have gathered, in this very special episode, we recorded something for the NHS at 75. Delighted to say that Rob Webster, Chief Executive of NHS West Yorkshire Integrated Care Board and CEO Lead for the West Yorkshire Health and Care Partnership, hosted a discussion with colleagues from across our integrated care system about the past, present and future of our NHS.
Hello everybody, my name's Rob. I think I know most people on the call, but if I haven't met you, I'm the Chief Executive of NHS West Yorkshire and I'm the Lead Chief Executive for the Integrated Care System in West Yorkshire. Thanks for joining today for a conversation about the NHS as we approach the 75th anniversary of the creation of the NHS. It's also, for those of you who work in care or closely with our care organisations, the 75th birthday of the creation of the social care system. Thank you for joining today. We're going to have a conversation in 3 parts. This is all part of an opportunity for us through the NHS Assembly to take stock of the NHS at 75, where it's been, where we find ourselves today, and where we might want it to go in the future. These anniversaries can sometimes feel a bit artificial or some people think it can be a bit daft to have a birthday of something, but they do provide an opportunity for us to do what we're going to do today. Now, in doing that, I think people should feel able to speak as freely as they like, be as critical or as positive as they like about the service, and also be as ambitious as they like for the future based on where we might want to go together. I'm delighted we've got so many people with us today. Now, the first bit of the conversation that we wanted to have really was to do a bit of reflection on, where we've been as a service. And there aren't many of us on the call. I don't think there are going to be any of us on the call, I hope, who are over 75. And therefore, the number of people who'll be able to remember things from the birth of the NHS is going to be limited. However, we've probably all got a memory, our first memory of the NHS. And I wondered if anyone wanted to share their first memory of the NHS with us as a way of getting into that conversation about where the NHS has come from. So we've got 3 people with their hands up. Dawn, why don't you start?
Hi there, my name's Dawn Greaves. I'm proud to work for the Health and Care Partnership and I lead the digital programme. So all the shared work that we're doing with digital across West Yorkshire falls within my remit. My first interaction with the NHS was actually when I came to work here. I think I'd been quite a healthy child, so I hadn't really interacted with it much. And I worked at Dewsbury Hospital. I came straight out of school on a youth training scheme and was overwhelmed by the size of the organisation and the amount of staff that were employed there. It seemed like such a close family network, though, even though it felt like it was such a big organisation, it felt really cosy and everybody seemed to know each other. Little did I know that actually that was a small organisation, just one hospital on its own at the time, and has since been through many changes over the years to be the size and shape that it is now. But back then, 16-year-old straight out of school, I was quite overwhelmed by the size, but felt like, as I said, it was such a lovely, friendly place to be. So I felt comfortable there.
Thanks, Dawn. That's perfect. So large organisation, but small and welcoming and made you feel comfortable. That's great. Anwen.
Hi, my name is Anwen Vickers. I'm an Quality and Diversity officer with West Yorkshire, and I work for West Yorkshire ICB. My first memory is attending an eye appointment at a little rural hospital in the Orkney Islands. I have a visual impairment, which the family worked out when I was 2, because I used to walk into everything, doors, gates, people, and fall over a lot. And my first memory is meeting a doctor and him sticking eye drops in my eyes, and then I couldn't see anything for 2 weeks because they had to look at the back of my eyes to see how they were working. But I have a strong memory of it being scary, but the doctor being kind and helpful and calming me down, despite the fact that I was absolutely terrified. Although I have to say I did have a fear of doctors for a while, because those eye drops absolutely tasted vile. They went to the back of your eyes. They sort of made you gasp out loud.
Thanks, Anwen. And that sort of sense of, I think it's really powerful, isn't it, that something that happened decades ago, that single interaction, you still remember how you felt and how the kindness of the doctor made you feel. Hey.
Hi, I'm Kay Richards, Senior Performance Officer for Kirklees. Similar to Anwen, my first sort of memory of the NHS was being very frightened but very reassured. I had to go for an EEG as a child. And I remember being in the hospital and it just seeming so huge and overwhelming, and you were having to follow lines on the floor to get to the right department. And once getting there, it almost was a little bit of a bizarre. I felt very special as well, because I got my head written on in biro where they put all the electrodes. And I remember I'd been very frightened, but the lady who did it, and I just remember her being, I mean, I was only maybe 4 or 5 at the time, but she seemed very sort of glamorous and beautiful, and it was almost a bit sort of like, oh, I've come to this very special place. So, and it was like, yeah, she was so very reassuring. And obviously I was only 4 or 5 years old, and having to keep still for an hour while they monitored my brain activity was a great deal of fun. But that sort of in awe of it, and I think as well, because my mum has been a nurse and then on to a practice manager, so she's had a full career in the NHS. It was never, we always had that sort of connection. And I will sort of say, if anyone's got a nurse as a mother, you're either given paracetamol and chucked back outside if you're ill, or they wrap you in cotton wool. So the fact that my mum actually took my illness seriously enough to take me to the hospital was quite, I felt very special.
So thank you, Kay, for sharing that. I love the idea of this sort of filled with awe, but feeling special, and the glamour of it. Ali Jan.
Thank you. Thanks, Rob. And hi, everyone. And I never thought of this before until you mentioned this, Robin, in terms of the first experience, because I'd have gone to my place where I started working for the NHS. But I arrived from Pakistan when I was about 3. And at the age of 4, with no English, I was in hospital for about a week to have my tonsils removed. And what I do recall is that compassion, that care. But one word that stuck out when my parents were collecting me from hospital was ice cream. And the nurse is saying, give him lots of ice cream. And if there was only one word I knew in the English dictionary, it was the word ice cream. So I cherished those nurses and those staff, because my parents then took me home and gave me lots of ice cream. But from the outset, I think it was that level of, despite no language, my parents didn't speak English, I didn't speak English, but there was that level of that authentic care, which I'll never forget.
It's really great. Thanks, Ali Jan. I guess, this is the beauty of these conversations. You sort of ask for people's first memories and you expect it to be about, I don't know, some kind of trauma or pain or anxiety. And what we're having a conversation of is about authenticity, glamour, being in awe, kindness, ice cream. Penny.
So my first experience was a little different. My mum was the very first woman in the UK to have a heart bypass operation back in the early 1970s. And what I remember, I think I was about 10 at the time, it saved her life, obviously. And it went on to save that same surgery, as has been refined over the years. And so she was a bit of a guinea pig. So that the research, the development, the innovation, the pioneering spirit of the NHS that saved my mum and then went on to save, has saved countless others. That's my first experience and first real memory of it. But yeah, that was my first experience, really, and obviously had a huge impact, not just on me, but on all our lives and all our family.
Do you remember how she was selected or any of the conversations around that at the time, Penny?
I don't. No, I think she was probably just right time, right place.
Yeah.
It was at Shotley Bridge in Durham. They were one of the centres. And it was, if you think that some of the 1960s hospitals about Shotley Bridge was, I think it was a collection of Nissan huts. It was one of those really, really old hospitals. And it was just this amazing surgeon, just amazing care.
Fantastic. Thanks for sharing that, Penny. Jean, why don't we take yours and then we'll have a bit, see if anyone else wants to come in and we'll have a bit of a recap and a move on.
Okay. Hello, everybody. My name's Jean Taylor. I work within the Bradford District and Craven Healthcare Partnership. And my exposure with the NHS has been because I was quite late diagnosed with a long-term condition and was very, very grateful for the support, certainly within Bradford District and Craven, because Airedale, their diabetes centre and support have been second to none. And I think if it hadn't been for their support, the shock of my diagnosis, I think I would have really struggled to deal with. As a result of that, their support, I like to help others. I chair the staff network within Bradford District and Craven. I just can't fault the service that I get. And, I'm very aware that I take up a lot of the resource. I need a lot of meds. And I just feel very privileged that I have the NHS to support me.
So that, is it worth, can I just check of other people being sort of inspired to work for the service because of their exposure to it? Kay talked about her mum being a nurse and those experiences. Jean, you've talked about, the privilege of working. Other people in that boat, does anyone want to share that kind of experience? Angry.
So I actually trained as a nurse many years ago. It wasn't actually the immediate exposure. It was actually later on when I saw the care that was given to family members that sort of spurred me on. And actually in social care too, because I'd actually done some time working in social care as a care assistant whilst I was doing my A-levels. And it was that really spurred me on to seeing the joy of caring for other people. Because for me, it was always and still is a joy to make other people feel better.
Yeah.
Whether it's emotionally or physically. And it's something that I see in a lot of clinical colleagues, still that joy of being able to help others. That's something that's integral to the NHS.
Really good. Thanks, Angwin. I remember working with a colleague and he'd been to Jönköping in Sweden, where they do a lot of work around how you develop teams around people. And one of the things they talk about is joy at work. And he came back to Yorkshire and tried to talk to people about joy at work. He didn't get very far at the time, I don't think. But you're right, isn't it? It's that there isn't much of a step between what we do and joy when we get it right. Sometimes we just find it difficult to talk about. So thank you for sharing that. Anna.
Hi, my name's Anna Diani. I work for Bradford District and Craven Health and Care Partnership in the medicines management team. I was inspired to come and work for the NHS because back in the 70s, my mother used to work on the geriatric ward at the Leeds Road Hospital, the old fever hospital. And I used to go in there to wait for her at the end of her working days and sit with the a lovely patient. And I was very, very young at the time, but I was quite an avid reader. And she used to like me sitting down and reading to her. And I remember turning up one day and she'd gone, she'd passed. And I was devastated, but I was really quite impressed with the way that the nurses sort of rallied around the family and looked after them. And it made me feel like, that's something I want to do one day. And albeit I didn't become a nurse, but yeah, that inspired me to be in this sort of work setting. And it's been a great experience for 18 years.
Thanks, Anna. That's really lovely story. Suzanne.
Hello, my name's Suzanne Sala. I'm the Senior Organisational Development Manager for the ICB in Leeds. For me, is the inspiration to join the NHS. I'm from an NHS family, so you hear the term "it's in my blood" quite often. If you have anybody who has family who work within the NHS, and it was literally every member of my family works in the health and social care system. But then also, I was quite an ill child, so I was the opposite to you, Dawn. I spent half my life in my early formative years at Jimmy's, St James's University Hospital in Leeds. So when I kind of rebelled, went into a completely different sector, and then when I first got a role which was in the health and care sector, it felt right, and it felt a little bit like coming home. You're in very familiar environments. If you've been brought up in an NHS family, you have generally been brought up in some health and care settings at some points, and then having your conditions treated within a health and care setting as well, it just makes it feel very familiar and very right to work within that.
Thanks for sharing that and recognising that we've all grown up in different families, had different experiences, and that's part of the beauty of the service, I think, isn't it? That it's free at the point of need, irrespective of your ability to pay, those founding principles, which I think people hold on to. So should we move on a bit then to the sort of second bit of the conversation, which is, okay, so we've got reasons why we do what we do, often inspired by our experiences, good and bad, of the system. Where do we think we are today then as a service? You all work in the service. Where do you think we are today? A big question, isn't it? Ali Jan.
So I'll kick off because I've got the privilege of recently taking on the role of interim chair of the Race Equality Network. And that's moving away from some of my comfort zone, which was leading, I suppose it's an interesting one, I was leading SEND and children's and mental health and kind of a raft of areas. And my first analysis is that in the NHS, we have done some great work. And if you compare us to the time that I was talking about when I was 3 or 4, arguably we have more diversity now than we ever had. And we've been able to name the elephant in the room on several occasions. We've taken tough calls. And if I can fast forward, Rob, when I came into the NHS, which is about 21 years ago, I came in to work on diversity and in particular race equality. And I remember, entering an organisation that I felt was really amenable for that conversation to take place. These were tough discussions, and they were conversations which were not always palatable, but the leadership, I think, enabled that level of constructive discourse to happen. And it wasn't just discourse. The most crucial part was, how do you convert the rhetoric into that reality? And locally in Bradford, I was working for the chief execs of what in those days were the 4 PCTs. And it was really quite warming to see, not just at local level, but I don't know if any of you recall the Improving Working Lives programme. It was led by someone called Madeline Lasbican, based in London. And the level of support that was there nationally to ensure that we could change the culture was just very much needed. And I remember working with the central team as well in London. And one of the key levers was, how do we get leadership on board? How do we ensure that, and I think you used this word a few, was it last week or this week, where you were talking about living comfortably with diversity. Diversity is not an add-on, it's part of our business. And the sooner we can live comfortably with diversity, the more change we can make. So for me, the glass was probably half full when I started, 3/4 full now, but on occasions we do have to remind ourselves, but discrimination still happens. And that weak link in our chain can sometimes make it appear that the glass is now empty again or half full. And what prevents it from being seen as half full, what keeps it at 3/4 full for me, is that fleet of foot response where we're seen to be fair in taking action. And the secret for me in remaining glass half full is the interventions that we have. And I remember vividly when Rocky Bennett happened, the DRE program was introduced. We had like I mentioned, the Improving Working Lives. We had impact assessments on race equality. And all these were really quite pivotal to some of the amazing changes that we now see in and across the country. And just to summarise, the feedback from the ICB, West Yorkshire ICB, REN, the Race Equality Network, has been really quite constructive. And they see the world from two separate lenses. The one is internal. What do they want to keep and build on? One is fair recruitment and using the res data more constructively. How do we do that? How do we ensure that we can minimise that racial bias in recruitment? The second part is well-being. And how can all staff feel that sense of belonging, that sense of empowerment, and minimise that sense of I'm different, which I think, again, you referred to. The third part was, and this is where the NHS has been great, I think, and we need to do more of this. How do we grow our own? We've done that for the last, so many years, but how do we sustain that? And if we can normalise it, then even if you leave, you being Rob Webster, the person who comes into your shoes maintains and accelerates that progress. It's not because you're, if you like, you have a commitment to it. It's something which the organisation owns and accepts. So I'll pause there just to give others a chance. But yeah, it's been a really constructive dialogue with setting up the West Yorkshire ICB Race Equality Network. We've got some amazing staff with incredible skill sets, and at the heart of it is their kind of concern and commitment.
So I think, thank you, Jan. So I think that point about naming the elephant around race and the fact that we've got a glass that's half full, we might even like what's in it now, and sometimes it feels like it's a bit fuller, but there's a big crack in it, and the good stuff keeps dribbling out. Seems to me to be real. And before I bring Dawn and Jean in, just be worth just pausing on this sort of conversation about diversity, race, protected characteristics. I think just to name the elephant. I think so. See, it's probably easier for me to say, looking at the numbers, that we have made progress, and we've not made enough progress yet. If you look at the staff survey, then we know that across the health and care system, people from Black Caribbean, Black African, Pakistani, Bangladeshi descent and communities more likely to be bullied or harassed by patients, citizens, and their own colleagues. And that hasn't changed enough yet. So there's more work to do. And that's definitely where we are today. I think it's nice to reflect that we've committed a lot of activity and a lot of action, and we've made some progress, but we ain't made enough yet. Lots of nods around that one, so thank you for that. Dawn, why don't you come in? So where do you think we are now?
So I think if go back to what I was saying earlier about Dewsbury Hospital feeling like such a large building, but actually in the grand scheme of things, it's small. I think we have moved on significantly from there with much more working outside the boundaries of organisations. So particularly from a digital perspective, that's rife at the moment. And I remember when I first came into the regional role, it feeling so difficult to try and move discussions forward where we're talking about doing things across multiple organisations. There was a lot of negativity, a lot of protectiveness of specific services, whereas we've moved past that. And I'm not saying we've totally got past it, but we have done lots of work collectively together across West Yorkshire, but also individually at places. Back when I first started in the NHS, I didn't even know Wakefield CCG existed. I didn't know that the GPs were related to what happened at the hospital. And what about social care? When did they come into the mix? It was all there all the time. We just weren't used to working in that way. And now it almost feels like we are getting to a point where we are seen as more of an integrated service. Again, still lots and lots to do. I don't think we're anywhere near the final line of making that integration, but the signs are more positive, I think. There's lots more positive conversations and some really good work progressing in those, which when we think about it, at the end of the day, we're all working on behalf of the same citizens. So why not work together, pool our resources to get further faster?
Thanks, Dawn. Such a great point. And I really like your honesty again about, I didn't really understand how it all worked. We have a sort of view, don't we, as do quite a few members of the public and partners, about how things work, which isn't the same as the reality. Jean.
Thanks. I just wanted to really echo Ali Jan's point, really, with regard to being the chair of the staff network and the long-term and disability staff workforce. I think the fact that there's the options for reasonable adjustments, flexible and agile working, a bit more equitable recruitment, certainly allowing for more disabled applicants. And I think having the networks to be able to have a seat at the table and to be a voice and represent maybe other members of staff that don't feel maybe comfortable to speak up. So having that opportunity, providing that opportunity and protecting that time, I think that's been really great progress with where we are now. And certainly the fact that we offer the staff surveys, I certainly think there's still a lot of work to do with them. But I think when I joined the NHS, the staff surveys, I think, were just seen as a bit of a box ticking exercise, whereas now we're looking at the comparisons and the figures and drilling down into bullying, harassment. We're looking at, providing other places for people to talk and share any experiences, good or bad. And I think, just trying to rule out the discrimination, enablism, and calling out against unacceptable behaviour. I think the opportunities for that were a lot better than they were.
Thanks, Jean. That's really, really great to hear. And I think Anwin's put something in the chat about some of that being amplified or supported by much better accessible information and communication, which is definitely something that I'm very passionate about. Suzanne.
So, again, linking in back to what Dawn was saying earlier, when I'm thinking about the current state of things, the people, the passion and the commitment within the NHS all stick out to me as being just really inspiring and amazing to witness. But as a system, not just the NHS, but the NHS and the social care system, which 75 years this year as well, incredibly stretched and incredibly complex, and quite hard to understand. So when I first entered the Leeds Health and Care system within my first role, there's over 500 organisations in total. It's mind-boggling. So it is the presenting to our public. They just see us as the NHS. Like whenever there's an organisation, they don't see all the workings which go on in the background, which I think is actually quite special. That it's seen as one organisation, but there's so many moving cogs and there's so many moving parts. And so many people which feed into that, but also makes it, quite complex and quite stretched at the moment.
Thanks, Susan. Yeah, one of my colleagues was saying this week that when they were growing up, they remember someone banging on the door because the mum was the district nurse, and they wanted the district nurse to come out to help because they needed help in the night and didn't want to wake the doctor up, I think was the subtext at the time. But they knew which door to bang on. And now they wouldn't know which door to bang on because things are just too complicated and people don't understand. And our sort of version of that now, I guess, is 111 or 999, isn't it? So how do we make things less complicated and easier to navigate so that things can be less stretched, I guess, is a really good challenge. Kay?
Thank you. I just wanted to reflect as well, sort of on the 75 years. Obviously, the last 3 years have probably been some of the most challenging the NHS has ever seen with the COVID virus. We've all collectively sort of come through the other side of that as a system, as a nation, as the NHS. And I think I just wanted to really sort of reflect on how incredibly, incredibly difficult it has been. I mean, for everybody, but particularly for frontline staff who, it feels almost unreal now that we're in this position where things are kind of back to normal. But that initial few months where, staff were PPE to the hilt, they were going in, we didn't have a vaccine, we didn't know enough about the virus, and yet staff were still turning up and working all hours of the day to save lives. And for us who were behind the scenes, we're not clinical staff, but the amount of staff that then stood up to either go into hospitals because they were clinical to help, the amount of staff that volunteered to do additional things. I know we had loads in our team who went on to wards just to be like a patient liaison, just comforting patients who couldn't maybe see family. And just that, it was amazing to see how people came together, that we were all there for the NHS. It is our job, but it is our passion. And I think that's, it happened in the last 3 years, but equally you could see that happening anytime in the last 75 years. Looking at that, if that happened in the 70s and the 80s, it can still see the people behind the NHS would have done the same. The technology's changed, the labels have changed, but I think the people that the NHS attract, and that's absolutely, wonderful, some of the best people, I think that hasn't changed, which is amazing. So I wanted to reflect on that because I know how incredibly difficult it's been.
Brilliant points. And I was just talking today to somebody, and we were talking about when there wasn't a vaccine, and how frightening that was. And then when at Swift in the hospital hub, I was present when we vaccinated our first person, and everyone was crying because it was kind of just this massive relief that something was getting better finally. Rob.
Good afternoon, everyone. My name is Rob Goodyear. I'm the Associate Director in the Clinical and Professional Directorate. Not quite answering your question, Rob, but I can tell you what the NHS was like yesterday. I was referred for a chest x-ray, 10 o'clock appointment. I arrived at 9:30, typically early. I was out at 9:45. They saw me immediately. The staff were brilliant. And that's how the NHS was yesterday, as I experienced. Absolutely brilliant.
Thanks, Rob. I don't know about others, and let's just take a quick sort of from the people I can see on the screen. My experience of the NHS recently, with me and my family, has been that things have tended to work on time. With the sort of, because of COVID restrictions and the way that we've had to marshal people in and out, it seems to me that when I go to the GP, when I go to an outpatient clinic, when I go for an appointment, they tend to be running on time in a way that they never used to. It might just be me, but that would reflect Rob's experience as well. So lots of nods there. It's kind of one of the positive byproducts, I think, is that things seem to have got slightly better on that front. Okay, so in terms of where do we want to be then? So as we get into sort of our collective futures, and we're stewards of the NHS, aren't we, and the care system. What do we want it to look like when we hand it over to the next generation? How do we want it to be, given all of those things that inspired us to work in it, and that recognition that things have been really, really hard, and people have been magnificent, but things have been incredibly difficult and are still stretched. Where do we want it to go next, and what do we want to achieve? Who wants to posit something? Who's got a dream? Come on, Angwin.
Well, it won't be a surprise to anyone. I would like a fully accessible health service if I had a magic wand, where everyone could access it, that's fully inclusive and recognises everyone's needs. And that's not because there isn't the will now, but I don't think there's always the opportunity or the resources for everyone to be able to do that in the way they would really want to. So it's not about not wanting to do it, it's just the ability to be able to do it or knowing how to do it. So for me, if there was a magic wand, it would be really easy for everyone to contact someone, to get an appointment, and really easy to get into a building, and really easy to have the support to understand what the doctor's saying, and to have your thoughts and feelings expressed back if you need that support. And that does happen for some people, but if there was name, it would be that it was the norm for everyone. That would be what I'd like to see.
Fantastic. I could comment a lot on that, but I want to let Rob come in.
Thank you. Considering this is the anniversary of both the NHS and social care, I'd like to see even better working between the two to allow those patients, as they leave an acute setting, to return home as soon as possible with the support to allow them to lead independent lives rather than being held up in a discharge queue, which I've seen quite often. So for the two to work even better together to make that a seamless transition between the acute and returning to the place that they live.
Thanks, Rob. Dawn?
I agree with a lot that's already been said, but I'd like to think at some point in the future, actually, people won't be relying on our services as much. We'll have a much happier and healthier citizen cohort, and people will take advantage from a lot of the preventative measures that are coming out to keep themselves well and see the value of doing that. But where they are ill and do need our services, then definitely agree with what's been said. I also like to think that we'll also have a happier, healthier workforce. Everyone feels overstretched, under pressure at the moment with what we've been through with COVID. I'd like to see a light at the end of that tunnel, and people can feel that they enjoy coming to work. And that's the majority. There's always going to be times where that's not the case, but that the majority of people are enjoying coming to work. They're not feeling drained at the end of the day. They love and are passionate about what they're doing and can actually be healthy and happy themselves.
Yep, that's the happy staff, happy patients. Was always the sort of Andrew Foster maxim, wasn't it? When you boil down everything that he worked on. Suzanne?
Again, mine's along a similar vein. I've got two words here, which is I'd like the NHS to be sustainable. And that's not just, it's sustainable in multiple definitions. So it's sustainable from carbon footprint point of view, but also sustainable in actually having the headspace and having the capacity to implement change and to be, to my second word, proactive. Quite often, not just within the NHS, but within the health and care sector, we're forced to be reactive to things. We don't have the ability, we don't have the capacity to be proactive. So if I was going to make any change within the NHS or the health and care system, it would be to really shift into that proactivity stage so that we can plan for the future and be able to implement things before the time that they're needed.
Yeah.
When we can see that need coming across.
Yeah. So there's a Richard Parry in Kirklees says quite frequently, the thing about waiting lists coming back is that we've got a group of people who we could get to know if we wanted, who are waiting for something, after which point they'll require something else. And instead of not asking them what that process is going to be like for them, what they need, we don't bother usually asking what's going on. So if somebody's living in a flat on the second floor and they're frail and they're about to have a hip operation, we know when they go, oh, they'll be able to go up the stairs, they might need something different for a period. But we don't ask them that until they've had the operation. And, on a process point like that, if people are waiting, we could plan all of that in advance, couldn't we? And make it easier. Through to, I guess you're also talking about how we make sure that we intervene so that, 3-year-olds get read to by their mum, dad, carer, others. They get a cuddle and they get talked to because Marmot says that's the thing that'll improve their life chances. that kind of proactivity is so important too. Ali Jan.
So when I put my hand up, I was going to say what Dawn did. So I had to recalibrate my thinking now, here, Rob. So I think in my, I remember about 18 years ago, I was working with the council around older people, and I was leading on the older people's contract, and they were going through a financial crisis. And I think it was one of the predecessors to Ian McBeath said, "Can you fund some of the grit we're doing around Bradford?" I said, "I beg your pardon." She said, "Well, look, we're not going to be able to grit as well as we did last year because of our financial situation. And would the NHS consider gritting outside some of the areas where you've got some of the nursing homes?" We don't do gritting. That's your responsibility. When we unpacked it, it made as much sense for us to do the gritting as it did for the council. And the reason was it was about well-being. It was about slips, trips, and falls, not for the people in the not for the residents in the nursing home, but the relatives would come to see them, during fairly difficult times weather-wise. And it dawned on me that as a commissioner, and I did a talk on commissioning grit for our senior management team. I said to my senior management team, I said, "I'm not a great commissioner anymore, I'm a great commissioner." And it was a metaphor for all those things that we don't commission, that we could commission, that would actually change the raison d'etre at the moment of the NHS, and that's what Dawn touched on. And for me, it is something around moving away from, and we've said this often, from being health to being well-being. And that needs a massive psychological, political, culture change. But if I could have that vision, it's about not calling us the NHS anymore, and rebranding, and that would take a huge amount of courage, because the NHS is obviously something which is in our veins, and it's in the veins of our predecessors, and we matrix it across to the veins of our children.
Yeah, I think it's one of the most trusted and most recognisable brands in the world. Now, within that, I mean, where I think there's some opportunity in what you're describing, Ali Jan, is I'll just replay a bit of a conversation I had yesterday where someone said, "We're not the National Healthcare Service, but the National Health Service." So we don't just do interventions. We don't just do operations. We look at health, look at all these universal services around speech and language, health visiting, vaccination, immunisations, all the things that we do to try and improve the health of people. That's a modern 21st century National Health Service needs to prioritise prevention. It needs to pay for things that you've prevented. It needs to incentivise those things in ways that we don't today. So I think there's a similar sentiment, I think, behind what you've described in that idea. We're a national health service, not a national healthcare service. Sometimes people just get stuck on that. Actually, we're just hospitals, aren't we? And GPs who do stuff to people isn't what we are. Ben.
Thanks, Rob, and thanks, Ali Jan, for your tale of Yorkshire grit there. My name is Ben Thompson. I'm a communications manager here in the NHS in West Yorkshire. And Rob, I want to just be really cheeky, if I may, and turn the tables on you, because I know we're coming to the end of this hour that we've had together, and thank you so much for listening to us throughout the hour. I want to know, what would you like from the NHS in the future?
I think we've touched on much of it today, and I fundamentally believe in the potential of people, and that's been proven to me throughout my life and my career, in my family and in my working life. And what we have at the moment, I think we've heard, is some absolutely amazing people. I loved what Jay said earlier about, the names have changed, the tech's different, but the people will get behind a common vision and deliver it and do it in the right way. What I'd quite like is for us to recognise that we're still in a system where we don't value the people who work for us enough, and particularly given the diverse nature of people that we have, and where we definitely don't value the assets of people themselves and citizens, whether they've got a disability or they have a long-term condition, or whether they're neurodiverse or neurotypical. We just don't value that enough. And I'd like us to see a health and care system that starts with a person, looks at their strengths, sees their assets, and recognises their potential. And then the people who work with them, whether that's a peer or a staff member, are fully supported to do their work with the best possible kit, the best possible drugs, the best possible training and development, so that we can have the best possible outcome. That's what I'd really like.
You've been listening to the We Work Together podcast. Thanks to Rob Webster, colleagues from across our integrated care system, the NHS Assembly, and everyone who works across our NHS. Happy 75th birthday. And of course, thank you for listening. Join us again next time when we'll be joined by more people who work together to help to improve health and care for people in West Yorkshire.